Breaking right now at 5, a major step toward an epic vaccination campaign against the pandemic. The Pfizer COVID-19 vaccine has now been approved.
That vaccine,
the vaccine made by Pfizer could start to roll out very shortly.
and it will roll out from places like Pleasant Prairie, where Pfizer has staged this vaccine for distribution. Katie Crowther is live there waiting for the first trucks that could roll out. Katie?
Yeah, Steve and Carol, so far it's been pretty quiet out here in Pleasant Prairie, where we know doses of the COVID-19 vaccine have already been stored and are currently being stored here. We know with this approval now, we're expecting to see trucks rolling out at any point. Initial supply of the vaccine will be limited. The first shipment will likely be enough to vaccinate about 65,000 doctors and nurses on the front lines in Wisconsin. There are more than 400,000 healthcare workers in our state.
It's a scarce resource that is not going to meet the need for all healthcare workers right out of the gate. So how do we think about cascading within that tier? And so that work is happening at the state level.
Governor Tony Evers requested that Wisconsin be a priority state for getting vaccine doses because of the high number of cases and deaths here. Whether that request will be granted by authorities in D.C. remains to be seen.
No, I have not heard. We're hopeful that we will hear soon.
Wisconsin Department of Health Services Secretary Designee Andrea Palm says there are no additional steps Pfizer needs to obtain in Wisconsin after it gets approval from the FDA. Leaders with some local providers like Advocate Aurora say they're anticipating vaccinations of frontline workers to begin next week.
We have been working on a prioritization strategy that prioritizes people who are most at risk for contracting COVID infection. And those are people who work in patient care areas where COVID is present. So emergency departments, ICUs, COVID units. And even within those units, we are trying to identify people within those units at the highest risk, the people spending the most time with those patients. And so we have a prioritization schedule.
And we know one of the next steps in this will be the CDC providing some guidance on dosing and side effects and things like that for states, and then states will pass that on to local providers. Now, providers are in constant communication with the states. Also, things we know, it will be UPS trucks here that will take out the vaccine and start delivering them to providers, and all of those UPS trucks will have federal U.S. Marshals guarding them to their destinations. Reporting live in Pleasant Prairie, Katie Crowther, TMJ4 News.
Very precious cargo. Katie Crowther, thank you.